Well, thank you all for being here. I guess in the sake of time, since this is just a 30-minute quick intro, I'm going to get started and we'll have people trickle in. My name is Tatiana Haverlog. I am an emergency physician and founder of Hello Sono. I've been using point of care ultrasound clinically for over 15 years in the emergency department and also in remote places like Everest Base Camp. I completed my residency and ultrasound fellowship at Mount Sinai in New York. And I was also director of ultrasound at the Brooklyn Hospital in New York for emergency medicine residency program. And over the last 3 years, I've been helping organizations and medical practices implement point of care ultrasound because I really believe in this tool. So thank you all for being here today. Um, a little bit more about me, some more fun fact. This is me doing ultrasound at Everest Base Camp at 17,000 feet on a glacier in a tent. And the point here is that if we can do point of care ultrasound up there, you can definitely have it in your clinic and in your hospital. And there's no reason why you shouldn't. I'm a proud mom of two cats. There's a Hunter and Sage, and I also recently really got into pickleball. So I'm happy to talk POCUS on the pickleball court. And before we move on, I do want to introduce you to Lana. She is a co-host for the session, and she will basically monitor the chat. If you have any questions you want to submit in private, you can just message them to her, and she'll help us with some polls as well. And she'll drop some links for you to review. So today's agenda, we are going to find out a little bit about you. So who's in the room? Then we'll jump in talking about how POCUS impacts the direct revenue. What are the cost savings opportunities? What are cost avoidance opportunities? And then finally, we'll talk about ROI. We'll go over our billing readiness checklist. That's really important if you want to be compliant with your POCUS billing. And hopefully, we'll have a few minutes for a Q&A. So, Lana, would you mind just putting up our first poll to see who is in the audience? Are you a provider in a hospital system versus uh, primary care practice or urgent care provider, administrator? You can select as many as apply. And all right, awesome. So, looks like we have some primary care providers, urgent care providers. And our second question is, okay, one inpatient provider. And our second question is, are you currently billing for ultrasound? So are you currently making any decisions, clinical decisions to ultrasound? And if so, are you billing for it? So if you guys could just answer that question, that would be also really helpful. Okay. Looks like we got only one answer for, maybe I'm not understanding it, but seems like no one in the audience is yet billing for ultrasound. And a lot of you, and it seems like most are not using it clinically. Can you guys see the poll results? Okay. All right. Now should be able to see them. Here we go. All right. I'm going to stop sharing and let's move on. So, when I think about ROI and point of care ultrasound, I think of three quantifiable ways how POCUS creates financial impact. The first one is the most obvious, and that's the direct revenue. So that's the revenue from direct billing, right? So POCUS comes with its own CPT codes. So if you save your images and document everything appropriately, you can actually bill for that procedure code. Another way that it impacts direct revenue is you can use POCUS to increase your E&M complexity, right? So you can move your, for example, level 3 chart to a level 4 chart, and that will bring you that direct revenue from having a higher complexity visit. Obviously, you've got to do it appropriately. The second way I think about a financial impact is that cost savings opportunity. And that really has to do with patient outcomes and what you end up doing with the patient. For example, preventing ED visits because you are now diagnosing and ruling out DVTs in your clinics instead of sending them to the ER. Uh, that's a cost savings opportunity. Also, having more accurate diagnosis early on might prevent certain admissions, like for pneumonia and CHF, and also consider the safety component, right, for cost savings, especially if you are in the hospital setting. So safety of procedures like central lines or paracentesis, thoracentesis, you don't get paid if there is an iatrogenic bad outcome, right? So using ultrasound to improve that safety can really help you save those healthcare dollars. And then finally, there's this cost avoidance financial opportunity. And here I'm thinking about um, maybe you are using an imaging modality like an X-ray that is underutilized, but it is expensive to maintain and staff. So there's an opportunity to bring in ultrasound to potentially cut down on that cost. These have more kind of the direct financial impact. And I do invite you to also think of indirect financial impact that's hard to quantify. And those would be your patient satisfaction scores, for example. There's plenty of literature from emergency medicine, primary care, inpatient medicine, showing that patients really love getting ultrasound. And there was one primary care study that showed that 95% of patients reported increased level of service that POCUS was used. So if you care about NPS, those patient satisfaction scores, there is that indirect potential, revenue here. Also consider POCUS being a differentiator in the market. POCUS will allow you to also see different types of patients, or maybe introduce AAA screening or something like that that you were not normally offering, right? So there is that indirect opportunity as well. So let's jump in the direct billing. And this is a bit of a busy slide, so let me take it easy on you. We are going to talk about non-facility reimbursements for global payments. So to make sure we are all on the same page, global meaning that it includes a professional and technical component. So this is more applies to outpatient clinics, maybe primary care clinic, urgent care, private practice, and these are all based on 2025 nationwide Medicare reimbursement physician fee schedule. So for our diagnostic ultrasound, these are some typical ultrasounds you might be using in outpatient setting. And they are ranging in reimbursement or physician fee anywhere from $56 to $180. So thoracic meaning lung ultrasound to say evaluate for pneumonia. Your DVT scan comes in at $115 of global fee. And then for your procedural component, so that one is ranging from $28 to $57. And that one is on top of the actual procedure you're performing. So these are actual CPT codes. You can take a screenshot of this, but we'll also send you a follow-up email with the CPT codes. They're also available for download on our website. So I just wanted to kind of give you an overview of what's the potential billable amount for one clinic. And here, this is a very conservative estimate for one clinic performing 10 POCUS exams per week. So if you're open 7 days a week, like a typical urgent care, that's less than 2 exams per day. If you're open 5 days a week, that's 2 exams per day. If you're staffed by multiple providers, the provider would be performing one POCUS exam per shift. So this is really not a large volume of POCUS exams. By the way, there are studies showing that 4% of patients in the emergency department receive POCUS, and we do have a study coming out that is looking at potential utilization of POCUS in urgent care. And what we found using real patient data from 10,000 urgent care visits, that 9% of those visits actually qualify for POCUS, and most of them were for respiratory complaints, so doing lung ultrasounds. So using this conservative estimate of 10 POCUS exams per week, your potential billable amount for physician performed exams using those that Medicare fee schedule is 30 to 90,000 annually. And if it's an advanced practice provider who's performing the exams, remember that's about 85% of what the physician fee shows. So your billable amount becomes 25 to $76,000 annually. So these numbers just show you that POCUS really does pay for itself and has an opportunity to bring you revenue if you are in those direct fee schedule models. So I want to take maybe 1 to 2 minutes to show you how you can use our ROI calculators to estimate a potential revenue based on these Medicare fees. So I'm just gonna, you either could have scanned that QR code or don't worry, you can just go to hellosono.com and let me just share this one. Sorry, you guys, this is still running. Everything is still running. Okay, I have too many screens open. Here we go. So if you go to hellosono.com, we have this tab that says ROI calculators. And here you will actually see two ROI calculators. The first ROI calculator is based on those global fees, and it's really meant for outpatient clinics, so those primary care clinics, maybe urgent care centers, private offices. So that one includes the professional and technical component. If you scroll down, there is another calculator on the bottom that only considers the professional fees right here. So that one is meant to be used by emergency medicine groups or hospitalist groups, or basically other facilities that are part of a hospital. And the hospital will bill for the technical component, so you would bill separately for the professional. So let's go ahead and plug in some numbers for the first calculator. So it will walk you kind of through the steps you need to take. So what kind of practice you are in. So say we are in urgent care. How many patients are you seeing annually? Let's put in 10,000 patients about. And then this is the important part. So how many ultrasounds of each type would you be performing per week in your center? And that's obviously an estimate. But I would say definitely maybe two long ultrasound to look for pneumonia, one renal ultrasound to look for hydronephrosis, a few soft tissue and musculoskeletal ultrasounds. And make sure you just don't put a negative number here because it's going to mess up your calculation. And then it goes on to the procedural POCUS exams. So say you do some ultrasound guided arthrocentesis, so you can put one per week. And in the end, it actually asks you for your payer mix and make sure that adds on to 100%. So we've got, say, 50% of your patients participate with Medicare. So you've got put 50 here, then 25 um, use Medicaid, and then you've got 25 private payer mix. And then just fill in your email. All right. Say that you're not a robot. And your results will be emailed to you in 1 to 2 minutes. I'm going to show you what your results will look like on this next slide. All right. Play from current slide. Okay. Let me see. So this is a type of email you are going to receive. On the top, it will tell you your basically monthly ROI. That's that billable amount from the volume of scans you anticipate. So that's a monthly billable amount, and then the annual billable amount based on your your payer mix. And just double check that all the numbers here are correct, that you didn't put any negatives here. All right. Well, I hope this was helpful because could be the first step when you're doing that financial research, to kind of put you on the right track. Obviously, if you use your the CPT codes that are in your payer contracts, you will get a more accurate estimate. So I think of this as more of a first step. And also, if you are a clinician in a bigger organization that you really believe in the POCUS as a tool for your to use for your patients, convincing your administrators, just bring this up for them, and tell them like, hey, there is an ROI opportunity. There is, POCUS really pays for itself. All right, I'm going to change gears a little bit and talk about cost savings opportunity here. And this is taken from CMS literature and also other evidence-based research that's out there. So preventing one CHF admission is $16,000 of cost savings. Preventing one pneumonia admission, $10 to $35,000. I'm putting these numbers out there just so you guys have understand the scope of the potential cost savings you can have with POCUS. Preventing one severe sepsis admission, $14 to $81,000, depending what you read. And then to continue, preventing one ED visit in the United States, around $2,000. So that DVT scan that you can rule out in your clinic, well, the healthcare savings are really significant. And then preventing one ruptured AAA, so abdominal aortic aneurysm, 28 to 43,000 of cost savings just for one. Um, and switching gears here. So the point of this slide is if you prevent even one or two of these admissions, your POCUS program pays for itself. And this is a great way also to use this data to bring to your payers when you're trying to negotiate your contracts with them. Like, hey, I want these CPT codes for POCUS because I am actually going to bring you huge cost savings, and this is the opportunity here. And then I also wanted to touch base a little bit on this cost avoidance opportunity with POCUS. So this is actually an image of an ultrasound image of ribs, one rib, actually from my partner who had a ski accident. And we happened to do an ultrasound. He avoided an ER visit, and we found his a rib that was broken. You can clearly see it right here. So we have linear bone structure and there's an interruption. So this is a non-displaced rib fracture. 100% sensitivity with POCUS. With X-ray, not so much. So something like that, maybe 40% sensitivity with X-ray. And the point of this slide is actually ultrasound is a lot better than chest and than X-ray in many different applications, including looking for pneumonia, looking for pneumothorax, CHF exacerbations, joint effusions, tendinopathies, and fractures and shoulder dislocations. So the point being here is if you are currently paying for an X-ray, the equipment, the maintenance, paying for those radiology reads, paying for a radiology tech, and we have a shortage currently. So you're probably paying premiums on that, and you're not utilizing your X-ray a lot, then there's really an opportunity to replace it with ultrasound for a lot of these applications. Oops, press the wrong button. So avoiding the X-ray costs per year, that would be around $120,000 per year that you can avoid by just introducing POCUS instead. And that brings us to our next poll. Uh, and it might not apply to all of you, but it has to do with how is your X-ray staffing, right? Um, so you can mark not applicable if that's something you typically not offer to patients. But we know that a lot of urgent care facilities and rural hospitals are really suffering from X-ray staffing shortages. All right, so it looks like most of you guys are getting 100% staffing, which is awesome. I'm happy for you. And then maybe one person has more than 50%, so a bit inconsistent. All right. All right, we can end the poll here so you guys can see the results. All right, I'm going to stop sharing and let's keep forming. So what is the investment to introduce a point of care ultrasound into your clinic? So I'm just going to do kind of a quick overview for one clinic with which is one location. And we are talking here, you want to purchase a device, you want to train three providers in four different ultrasound applications. That's kind of the starting point. And you want them to really complete a comprehensive training program that meets the current credentialing standards put out by AFP, by ASAP, by AIUM, all the major medical organizations, right? So that actually includes review of educational scans. You might also need to invest in an archiving solution, especially if you don't have PACS available in your clinic, right? So you might need to have some cloud storage. So just to have the starting cost for that first year would be around $20,000. So that's your investment. Obviously, it depends on the device you get. The handheld devices, probably really good handheld devices are around $5,000, maybe a little bit cheaper. You can also get a card-based system that's a lot more pricey. So you can keep moving in price if your budget allows to get a better device. And this is just an overview of the yearly investment moving forward. So in your year two, I put in a pretty big range here, right? So you can stay really economical and have that $1,000 for your device maintenance, maybe some CME for the providers that they can do some online learning, versus you have pretty large turnover of your providers and you need consistent, maybe annual. Um, Workshops for them, right, or refresher workshops. So that can obviously add up. But the point being that the cost here, the investment is really not large for one clinic, and it actually becomes less per clinic the more clinics you have. So I want us to kind of go back to that initial slide I showed you with the three different ways that ultrasound gives impact, and now we're going to put some numbers to it. So from the direct revenue, what we discussed here is that if you're doing 10 exams per week, that's an opportunity to have a billable amount of $25,000 to $90,000 annually from your POCUS program. With a cost savings opportunity, I'm going to put some numbers to this too. If you're avoiding one high cost admission per week, so that's one CHF exacerbation or one pneumonia exacerbation, sepsis, AAA per week, there's an opportunity to save almost $1 million per year. And then finally, that cost avoidance piece. So it doesn't seem like it applies to most of you here, but if your X-ray staffing is a logistical nightmare, or if you're not using your X-ray a ton, then the prob it could be that the most cost-effective way is to bring in point of care ultrasound, which will allow you to actually do more and see more different types of patients. Um, and that's a cost avoidance of $120,000 annually. I'm going to switch gears here and just talk a little bit about compliance billing. Not just compliant billing, but what you should really have in place before you start billing for POCUS. We do have this POCUS billing readiness checklist on our website. We'll also share it with you in the email afterwards. But there are six major components. One is obviously you need to make sure the CPT codes for POCUS are in your payer contract so you can actually directly bill for them if you are in fee for service contracts. If you're in global rate contracts, you can still negotiate a carve out for those CPT codes. So make sure you do so. Second is it's important to have trained and credentialed providers, although there's a lot of kind of like gray zone. There's not a requirement, it's a recommendation, but I think it's a very strong recommendation. And it's a really good idea if you get ever audited for doing POCUS by your payer, that you have really strong documentation backing you up that yes, your providers are trained and credentialed. And that means having your own credentialing protocols internally. You must save representative images and clips in a HIPAA compliant way permanently, indefinitely. So make sure you have that cloud storage set up, or you can also store it on your internal server. And yes, so make sure you have that also for audits. And then step number four is you want to make sure your documentation is appropriate. That means a procedure note that covers, the indication, the findings, your interpretation, and also that, very importantly, that medical necessity. Why was POCUS indicated? That's really the reason why a payer would reimburse you is your medical necessity is there. Uh, it is a very, very good idea to have a quality assurance program. Most organizations do recommend that 5 to 10% of POCUS exams get reviewed for quality, and it could be internal or external. And you want to keep an audit trail, right? So your QA, monthly QA reports. And then finally, code and bill correctly. So use the correct CPT codes, modifiers as needed, and also make sure you are incorporating POCUS when you're determining your E&M levels. All right. So key takeaways from this lecture, I think, is POCUS does have multiple financial wins, whether it's from direct billing or cost savings or cost avoidance when appropriate. Documentation and training are essential for billing success. And we do whole webinars, and there's information on our website as well about the requirements. And also, I think there's a really huge benefit for practices that are underutilizing X-rays anyway, to replace them or reduce their usage and use ultrasound instead. So one more thing here is that we are having a webinar on February 3rd, and that's going to cover POCUS use cases in everyday practice, covering mostly primary care and urgent care use cases and benefits. So we'll do a deeper dive on each application. And sorry, this is a QR code you can join, or we'll also share it with you later on. All right, I think we can take some questions. This is a QR code that goes to all our links and all of our downloads, and even booking a meeting if that's something that you think would be helpful to you. Lana,